Hello, Elliott here, osteopath at the Revitalised Clinic. I'm here with my colleague Ellie Benman, sports therapist at the Revitalised Clinic. So what we're going to do today is just show you how we do a little bit of detective work at the clinic, and that's just to make sure that we know what we're treating, we know the extent of your injuries, and we know what to expect going forward with your injuries. So Ellie came in with a little bit of back pain, a little bit of stiffness, but what happened on further questioning is that Ellie said that she also started to feel that her left leg was feeling a little bit funny. Now that can indicate that there's some nerve involvement. So I'm going to show you a couple of tests that we did, just so you can see how we can come up with a more accurate diagnosis at the clinic. So what I would ask Ellie to do is just to slump to start off with, and then straighten her left leg, and then ask Ellie from here, does that make your pain worse? To which Ellie will reply,
yeah.
So then what we want to do now is shorten the nerves in the neck to see if that has an effect on the pain in his leg. So Ellie, if you now look up, and then does that reduce your pain?
Yeah.
So that's a slump test, you can relax now. And what we're trying to do is see if there's any nerve involvement, and see when we take the nerves off stretch to see if it reduces the pain, which it does, meaning there might be some nerve involvement. Ellie also experiences more pain on sitting the longer that she sits, which is an indicator for a potential disc issue. And I'm just going to show you this. You might need to come a little bit closer, closer, Lizzie. So from here, you'll notice that when I check the reflexes on Ellie's left leg, the reflex is quite strong, but when I check here, it's a little bit weaker. Now what that can indicate is that the muscles at the back of Ellie's left leg have lost their tension, so this leg kicks out more. That is once again further evidence that there might be some nerve involvement. So long story short, it just means that we want to keep a close eye on this. We'll limit load a little bit more than we otherwise would, and we give advice going forward to make sure that Ellie is less likely to experience a flare-up of a disc injury or nerve injury. So that's how we just take care of you at the clinic. And obviously, if you have any questions, if you want to know what we can do to help you, we offer free consultations. Just go to www.revitalisedclinic.co.uk, go to book appointment, and then just click free consultation, and it'll be my pleasure to speak to you about how we can help you going forward.